Welcome from Queensland in Australia. My name is Erik Hohmann, one of the Associate Editors of Arthroscopy, and it is my pleasure to introduce the July 2015 issue. This issue contains 6 systematic reviews and 17 original articles, and 1 travelling fellow report. Our Chief Editor, Dr. Lubowitz, has commented on 5 of the systematic reviews. Please read his valuable comments in conjunction with the article. Dr. Lubowitz has concisely summarized the take-home message of each review. A systematic review co-authored by our chief editor searched the body of literature for advantages and disadvantages of 4 commonly used tunnel drilling techniques for ACL surgery. The results are not surprising and highlight the fact that each of these techniques have specific problems. Of the 17 original articles, 7 papers dealt with the knee joint, 4 with the hip, 1 with shoulder instability, and 2 with ankle pathology. Yun et al. Reported on their results of arthroscopic release of the extensor carpi radialis brevis insertion for lateral epicondylitis. Interestingly, there is gender disparity in patient satisfaction. 31% of females were not satisfied, whilst only 4% of males were dissatisfied. Gilmer et al. Reported on the benefits of a surgical skills course on knot tying ability of surgical residents and demonstrated an increase in knot tying speed, but no differences in loop security or knot failure. So it seems that we are getting faster, but not necessarily better. Dr. Moroder and colleagues looked at flattening of the bony glenoid in patients with atraumatic and traumatic instability compared to a healthy control group and demonstrated flattening in both groups. A somewhat novel approach and certainly interesting reading. Dr. Tannenbaum assessed acetabular retroversion in patients with asymptomatic hips. His primary goal was to compare gender differences, and he could not establish any significant between gender differences. These findings are interesting, given that there is anecdotal evidence that pincer lesions are more common in the female population. Dr. Schuster from Germany investigated the combined treatment of high tibial osteotomy and microfracturing in middle-aged patients with various deformity in grade 3 and 4 medial compartment osteoarthritis. The most common interesting part of that study is that on plate removal at 1.5 years, good and excellent regeneration of cartilage was observed in more than 87% on the femoral condyles and 75% on the tibial plateaus. Check out their video. In an interesting biomechanical study, Kim and his fellow researchers investigated the effects of axial loading, valgus stress, anterior drawer test, and its combination on anterior tibial translation with different knee flexion angles, performing an anterior drawer test. Not surprisingly, there were significant differences between the ACL intact and ACL deficient knees. However, the combining different vector forces did not result in significant differences in anterior tibial translation in both groups when compared to the anterior drawer test alone. Food for thought. Dr. Li from China reports on 5-year outcomes in patients who either underwent ACL reconstruction with autograft, irradiated allograft, or a combination of the two. He could not demonstrate any significant differences between the 3 groups, with the exception of KT1000 measurements. In his study, allografts were nearly twice as lax at final follow-up. Given the recent concerns with the high failure rates of allograft ACL reconstructions in younger patients, this study is a useful addition to the current body of literature. Dr. Saffanini from the Rizzoli Institute in Italy reports on the results of a multi-center study using collagen meniscus implant for lateral meniscus lesions. I still remember my days as a sports medicine fellow when CMI was first used for the treatment of medial meniscus lesions with good success. However, there were concerns that it would not work for the lateral meniscus lesion because of the higher shear and peak forces. The included number in Saffanini's studies are rather low and the follow-up is only 2 years. Both TECNA scores improved significantly over the 2-year period and implant survival at 2 years is 89%. Longer-term studies and more patient numbers are needed, but the reported results are certainly encouraging for this difficult problem. Thank you and enjoy reading the July issue.